So today we're doing wound packing, the skill, and before I get started, I'm going to ask my patient if they have any pain, and if they do, I'm going to give them the analgesics. Of course, I'm going to check the doctor's orders to make sure we actually have an order to do this, or the wound care specialist orders. Having done that, I'll gather my equipment and bring it to the bedside, and we'll get started. I'm going to wear PPE because I am at risk for splashes when I irrigate. So let's get started here. Come on in, and of course, wash your hands. Then you take off your tray and get that ready, your plastic, and start getting your tray ready. I'll just put these goggles on right before because it's actually kind of hard to see here, but here we go. Then you can hold on to an edge, move things around a little bit if you need to. Just remember that 1-inch border is where the table begins. So anything hanging off is not in there. You can move things around. You could use this drape if you wanted to for catching some of the fluid, but I've got a blue pad here already, so we don't need that. Now when you're placing your forceps, I recommend picking them up, dropping them in the center of your tray, going tip to tip, and then thinking about where that 1 inch is and where your fingers are going to be on the forcep. Because if you think about it, my fingers go about that far down, that's what's in the 1-inch border, the sterile part's over. Just to prevent those contaminations. This we don't really need, but who knows. Keep it just in case I lose a forcep. Same thing, drop it in the center, tip to tip, into that 1-inch border. Okay, the bag, we could use this for garbage, but I already have a garbage going on. And then we've got lots of sterile gauze here, which is great. I'm going to take a couple 2x2s and put them here, and I'll show you why in a second. Okay, so then I want to add my saline, and as you know, you check it 3 times. Yes, it's saline, it has not expired. So you'll crack that open, it's brand new. And pour away from the label. And of course, if I get a splash on my sterile field, then that's definitely an area you'll want to avoid. But no splashes today. I'm going to get all my equipment ready here. So I'm going to take my, now a 30 to 35 syringe is fine. That's the right pressure. So a 30 to 35. I've got a 35 syringe here. So now when you banana peel, please remember to hold both sides down so that you don't accidentally rub the sterile area against something your finger touched. So banana peel really means hold both sides down. Take that out, you can garbage that. And then you're going to need a special irrigation tip. This is specially made for wound irrigation. So you'll want to find this irrigation tip, which shouldn't be hard to do in your clean supply room or sterile supply room. Open it up, and again, banana peeling in such a way that you get all the parts your fingers touched right out of the way. Then you put that on there. Make that nice and snug. And then I like to rest this area here so that later on when I've got fluid in here, I can draw some up now. There's no harm in doing that. I'll just draw it up now. And you'll see what I mean. So that when I rest it, if there are any drops coming off that, it's not going right through my sterile field. So that's that. Now we're ready to do the usual, and that's take off the old dressing. So my hands are still clean. There's no need to have to wash them again and again. So I'm going to put my gloves on here as a barrier to protect myself from whatever's under or on the dressing. Of course, gloves should go over top of the gown. If the gown is long enough. All right, now we're going to walk off the old dressing. Now, you can take an alcohol swab, will work just fine. Adhesive removers, which hospitals have, will work even better. But alcohol swab's good too. And then you just kind of want to really get underneath an edge. You can start with one edge, you soak it with the alcohol, you get underneath it. And once you're under there, you just start working it off by soaking, progressing around and soaking the sticky part of the dressing. And you're pushing down the skin so you're not ripping on the skin. And so you're literally walking this thing off with your fingers and the alcohol swab. And this one is actually really easy to come off. And sometimes you'll have that with patients where it won't take much work to do. Like this one, it's pretty easy. Of course, is there an odor? What's the color? How much is there? Take note of that for charting later. Get rid of this. Now my hands are contaminated. So let's get rid of these gloves. Let's give them a quick wash. And now we're going to proceed to irrigate the old packing out. So now I do want to don the full-on PPE. For later. I'll take clean gloves for now. Now the most important thing when you're irrigating the old packing out is that before you start pulling packing out, you irrigate underneath it. Because if it's sticking to good granulation tissue and you just pull it out, like you only wet the top but the bottom's dry, you're going to pull out good granulation tissue. And that is obviously problematic. So pick the forceps you don't mind getting rid of, because they're going to be done after this. And sure, you can start by irrigating the top just to get it wet and start getting things going, but carefully picking up an edge and getting right underneath and doing full pressure. So one came out really easily. And getting right underneath this last piece, irrigate, 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 and it's off. Didn't destroy any granulation tissue. And then these forceps are done. You can get yourself a little more saline, and you can continue to irrigate until you get pink or clear returns. So you're irrigating with a good amount of pressure, irrigating inside of the whole wound. And let's say for time's sake, I'm getting pink to clear returns now. So my irrigation portion is finished. Let's assume, we have to assume that maybe some splashing did occur on my gloves. So now's the time when I want to get rid of these gloves, because I assume that they have something on them. I want to wash my hands again. Because I can't see a thing right now, I'm definitely taking off my goggles. I don't really need those anymore. Okay, and then you want to dry the inside of the wound out. Now, if your patient was able to turn on their side, that would have been an ideal position for them to be in, because things would have just drained out naturally. But sometimes it is a deep abdo wound, and you just can't do it. And so there's a number of ways to do it, and here's one way. One way you could do it. You can grab. Again, my hands are clean, and I'm not planning on touching anything right now, so I don't need gloves right now. You can grab yourself 4x4, and again, there's more than one way to do this. You can do variations of this, but the important thing is you want to drop it in without bringing in any contaminants. So that's the best I can do. I wouldn't move this around anymore because I don't want to drag something in from that clean skin into a sterile area. I'm just letting it soak up whatever it's going to soak up, not moving it around. Then just lift it out, and I can see I'm going to need to do it probably one more time. That probably wasn't thick enough, so I'll fold one in half. See, I told you there's more than one way to do this. Here's another technique you could do. You could take this, you can fold the 2x2 or 4x4, sorry, in half. Then you could pick that up, and you can just kind of drop that in without moving it around. You don't want to contaminate the wound. That's actually pretty good. The wound bed in this case is completely dry now. And it doesn't have to be. It just has to be more moist is okay, as long as there's no puddles of saline down there. So we don't have any puddles at this point. So we're good. Now it's time to, we've dried out the inner wound. Now we can say, well, you know what? Let's just give the peri-wound area a quick cleanse. Not a bad thing to do at this point before we pack. So we do the usual. Now, another thing I want to show you guys is that when you get your 2x2 ready, let's wring them out really well. Try this technique. And while I'm on the topic of technique with forceps, please ensure you're holding your forceps like a pencil. A lot of students hold them like this. and so that when they get distracted, the tips go up and they've compromised sterility. So please hold them like a pencil. Wring it out. And then we can take this and we can cleanse around the edge of the wound. That didn't stick very well, so get rid of that. Sorry, that came apart at the last minute. Do that again. Wring it out. Wring it out. Let's get it on the forceps again. Around the wound edge, just right around. I look up at it this way. Don't look at it that way. Look up that way. It looks pretty good. Looks clean. I can take one and dry it now. And dry around. Looks good. Nice and dry. Okay. Now, the next part you can do after you pack or before you pack. I like to do it before I pack the wound. Everything's more or less dry. I like to put skin prep around the edge, but some people like to wait till after they've packed the wound. It really doesn't matter too much. I can keep my hand away from it. If I'm worried about getting contaminants on me, of course I can. Let's put gloves on now, or I can do it after I pack with my sterile gloves, which is another option. I like to have everything ready so that I don't forget it later. But again, you can do a variation of this if you want. So just going around the wound edge with the skin prep, and the purpose of this is to stop maceration from the moisture of the wound. So that's one thing we do with the skin prep. The other thing we want to do is go around a wider circumference so that the dressing that we put over top will stick nicely. Of course, there's some dressing products that you don't require skin prep with, like a Mepilex, but that's a detail. Generally speaking, for all these gauze dressings that we're using with tape, it's really good to use skin prep. So now our skin prep's ready, and we just have to measure the wound and pack it and dress it. So measuring the wound. And I'm just going to get someone to get me some more Q-tips. So I'm paging a nurse because I realized I only have 2, and I actually want more than that for the way I'm going to do it. So I can get just more Q-tips on my table, and I got these Q-tips here, and let's go and let's measure this. So I have a ruler. You got a couple rulers to choose from here. And again, there really is more than one way to do this part, but I'll just show you one way. I can go like this. I can say, look, the length of the wound, assuming the patient's head's up here, feet are here, here's the length. Okay, so I get my number there. The width of the wound, going from 3 to 9 on the clock. There's my width. And then finally my depth. And that's where I use these two two Q-tips for. Go like that and say, okay, well, there's my place. There you go. There's my length. Sorry, it was right there. There's my length there. Or, sorry, depth. Okay, so I've got my measurements. So that's all done. Now we just pack it and dress it. So few different ways to pack it. You could use just forceps. I personally like to use sterile gloves for a wound like this. I find sterile gloves to be a lot easier. So I'm going to drop my sterile Q-tips into my field, or I can just take my forceps and drop them in that way. So there they are. Also, before I pack, I also want to assess the wound bed. So I'm looking at it and going, how does it look? Is it a nice pink granulation tissue? Is there any areas of slough? Is there areas that might be necrotic or bleeding? What does the wound bed actually look like? And then I'm looking here and thinking I might need one more 4x4. So I would, if I didn't have it, I'm stuck in the room, I might get the patient to press the call bell, and the nurse comes in and says, what do you need? I say, can you get me another 4x4, please? Because I might run out of 4x4s to pack it. I just want to have everything ready. Next is your sterile gloves. So you can do this on the patient bedside. That's not a problem, as long as you don't contaminate your field or the wound field. I mean, I probably wouldn't be this close to the wound, but this is just for sake of demonstration. So maybe I'm doing it at the foot of the bed or somewhere or on another table. So you want to open that up. Okay. Get the memory out of this package so that it doesn't spring back on you and contaminate your gloves. Then always remember that the inside of the cuff is considered non-sterile, regardless of the packaging. So you can touch your fingers on that, and you push it on your fingers through. Okay, so there's one sterile glove on. Then you put your fingers under the other cuff, but don't touch your thumb to the inside of the cuff because it's considered non-sterile in best practices. So open that up, put that on, and then you go sterile to sterile to get it right. Now notice I've kept my hands nice and high so that they don't touch anything non-sterile. And don't worry about the garbage till after, because that's a great way to contaminate your gloves if you start grabbing things. Just leave it. Now it's time to pack the wound. So now I can go right onto my gloves because I'm using sterile gloves. Everything in here is sterile. And I'm looking at it going, I'm thinking that's going to take a couple of 4x4s and a couple of 2x2s, but we'll see. So let's take this, let's wring this out. We don't want it soaking wet. We want it completely moist, but we don't want it soaking wet. Okay, there you go. And you can, there's lots of different ways you could do this. I think for a wound like this, I might just bring it out a little more. But again, it depends on the wound. You have to just try different things to figure it out. But this is the idea. And then you use this to start pushing it in. Now, you really don't want it to touch the skin because that's going to bring contaminants in. You just kind of feed it in like that. And so I have one of my colleagues has brought in a 4x4, and I'm just going to ask her to drop it into my field because I don't want to contaminate my gloves. Thank you. So we'll take one of these, soak it. Got lots of saline here. It's nice and soaked. Get rid of that. Oops. Splashing there, so stay away from that area of the tray. Now that's pretty good. I can continue going with this, but for sake of time, I mean, I'm probably going to need another 2x2 in there to round out the edges. You want your wound fully packed. You want it right up to the top edges, because if you don't, the wound edges will curve over and round and it won't heal properly. But you don't want it overpacked, because if it's too tight, the granulation tissue won't grow. For sake of the demo, this is pretty good. We could probably get a little more in here, but for sake of time, we'll say it's packed up right to the top. And all the side edges are done. I might even want to use ribbon to get some of those little bits there. And I have to remember, what have I put in? Like I put in, for example, in this case, 2 4x4s. I need to chart that later on. 2 4x4s are in this wound. So that's it. So it's in there. It's all dried. We've got skin prep on. Skin prep's ready. Now I can use these like clean gloves. And I open up my dressing. And it's a 4x4, so it's, take it here. Put a sterile area down on top. There's my 4x4, and then there's a tape in the hospital that like a me-fix tape or something. But right now we'll just use this like IV tape to tape it. But you'll find all kinds of different tape products, so you can choose whatever fits the patient's needs, allergies, or whatever. So we got tape sticking that down there, and we'll put tape in this case on all 4 sides. and we'll do the other two sides, and we're done. And then we go chart it all.